Hi, welcome to another episode of Facebook Live with Veterinary Referral Center of Central Oregon. I'm Jen Bentley, the dermatologist here at VRCCO, and we are going to be talking about arthritis. And we also brought on a special guest, Dr. Mauricio DeHowich, to help us out with this topic. He is a board-certified surgeon here, so he's truly an expert, and we're glad to have him here to be able to give us your opinions and advice on all of these different therapies. I also have Shelby in the back who's manning the camera, and I've got Denali also to field all of your questions, so please, this is supposed to discussion. Please chime in if you do have any questions. But I'll just get us started. What exactly causes arthritis? What are the different types of arthritis? Can you summarize that in like a small amount?
Does everybody have 3 hours?
Yeah, right.
That'll be the very first beginning of it. So I guess arthritis is, how do I start this? It comes from inflammation, okay? And for whatever reason, we have inflammation in our joints typically, and that causes a cascade of events that leads to different changes in the joint that makes the joint hurt. And most of it is mediated by some sort of degree of inflammation. And so that inflammation leads to degenerative changes, which can come in the form of osteophytes, cartilage loss.
And these are all changes you can see on X-rays.
Some of the time, but not all the time. The problem with X-rays is you can't really see cartilage on X-rays. And so when we are looking at X-rays and we're looking for arthritis, we're looking for past that. And so it's not the most sensitive tool. If we wanted to be as accurate as possible at kind of diagnosing things, we'd probably be doing arthroscopy, which means sticking a camera in a joint, which obviously is not really practical or ideal. Or for example, we might say, well, can you do an MRI? But an MRI on a dog, well, we have to anesthetize them. So again, not really practical. So a lot of times we settle for X-rays because that gives us a lot of information, but certainly not all the information.
Mm-hmm. And as far as where that inflammation comes from, I mean, we hear all the time immune-mediated arthritis. I guess that's one cause. Is there other types of causes just besides immune-mediated?
Yeah, there's a lot of causes. So immune-mediated, typically we have what's called immune-mediated polyarthritis, which is basically the immune system, for whatever reason, starts attacking the joints. And fortunately, that's not really common, and it's a diagnosis that we make by getting a joint sample, looking under the microscope, excluding some other things, whatnot. But most of the time, what people are used to is kind of the run-of-the-mill arthritis. And so the big question with the run-of-the-mill arthritis, just like everybody gets old and eventually gets achy joints. I'm trying not to, but I'm trying to not to. I'll stop at that. But nonetheless, dogs will get it too, cats will get it too, and the question is why is this happening? Is it just regular wear and tear, or is there some underlying cause that's making it go at an accelerated rate? So, for example, if your dog's you could immediately say, oh, my dog's 8 years old and it just has arthritis. But if it just happened from one day to the next, it's probably not arthritis.
Right.
More than likely, what happened to your dog is it probably tore its ACL. Mm-hmm. And so those are the things that you have to kind of consider in the back of your head is, did this happen all of a sudden? Or has this been kind of a slow progressive thing that's kind of more consistent with arthritis? Nonetheless, you can have slowly tearing ACL that can make it look like arthritis when it's really not. So I guess what I'm getting at is probably have an exam done by your vet or an orthopedic surgeon that is very comfortable with these guys, and also be able to think about all the potential differentials, because every joint's different. And every joint has its own set of problems, and that's going to kind of key us into what could be that problem. And at the end of the day, yes, it could be arthritis, but there could be sort of an underlying issue that we can correct and slow down the progression of arthritis, like doing knee surgery. We see quite a bit of elbow arthritis, and unfortunately, a lot of the elbow arthritis that we see is because owners or veterinarians fail to diagnose elbow dysplasia very early in life.
Yeah.
And so, unfortunately, if that goes undiagnosed, then by the time dogs are, depending on the situation, by the time dogs are, 5, 6 years old, they could have like a 12, 14-year-old elbow. And so a lot of it is being proactive and trying to identify.
What would owners look at
Great
home?
question. So if you have a young dog and you notice any limping, I take it seriously. If it's persisting. Yes, we all twist our ankles. We all have our but if it keeps popping up, then I'd say, hey, maybe I should have this checked out. And even if you take X-rays and the X-rays look normal, if it's still happening, there still could be a problem because, like I said before, X-rays can't look at cartilage,
right.
and so that's something that not only the vet can miss, but of course the owners can be misguided, unfortunately. So usually when we're thinking about elbows, and I see a dog with consistent elbow pain that has perfect X-rays, I actually do a CT if it's a dog that is part of the group of dogs that classically gets elbow dysplasia, for example, and then I can see things that way. So just because it looks normal doesn't always mean it's normal, which makes it tough, unfortunately.
So arthritis is a hard diagnosis to make. It's not always straightforward, and every joint is a bit different here. Do we have a question, Denali?
We do. So McKenna would like to know, is there any way to prevent arthritis? Supplements, water therapy? I have a year-old golden and want to prevent it in any way.
So awesome question. I think that the best thing that you can possibly do is low impact exercise and keeping them at a good body weight. And I think that's what everyone will tell you. If you can keep that weight at a good, if they're not obese, that's going to go really, really far for you. And then maintaining that exercise at a kind of a low impact. So if your dog likes to swim, I'd encourage swimming. I would discourage, activities where it's, really hard stops, really hard starts. Those things where they overstress the joints. That's kind of that's going to cause a little bit more wear and tear. Always easier said than done because dogs are dogs and you can't keep them in a bubble. And part of the fun of it is watching them chase the tennis ball, of course. So it's going to be one of those things where it's a balancing act, and unfortunately you can't fully prevent it. From a supplement standpoint, what you give typically from a supplement standpoint is you are pretty much buying a precursor of what's in the joint fluid. So if we're giving omega-3 fatty acids, if we're giving, for example, glycosaminoglycans, if you're giving glucosamine, chondroitin, at the end of the day, typically all that stuff is some sort of precursor for joint fluid. And the idea is that if you provide the building blocks in excess, whenever the joint needs more building blocks, they're readily there, and bam, we have nice joint fluid. There's not an excuse for bad joint fluid. And the reason you don't want bad joint fluid is because you want a nice high viscosity joint fluid that's going to allow for normal range of motion. So if you are giving supplements, unfortunately, it's not going to reverse any arthritis because all you're doing is providing building blocks if it's to normal joint fluid, and normal joint fluid per se cannot heal cartilage. The cartilage we're born with is the cartilage we have. So you won't be able to reverse anything, but you'll hopefully provide a sort of the optimal environment so that if your body needs building parts, it's there for it.
I'm always suspicious of supplements. I like fatty acids in my field for the skin and coat. Are there any studies that are saying these things are beneficial for preventing arthritis, or is it just like it may help, it may not? We really don't at this point.
Yeah, it's a great question. I think one of the problems is, I probably shouldn't say this, but the companies that sell this stuff, obviously they're not really interested in doing the studies if the product is really well, right? So I think that there's a lack of studies out there. I will say that there's pretty solid evidence for omega-3 fatty acids. So
okay.
I usually tell people, hey, if you're giving something with omega-3 fatty acids and it's a kind of complete supplement, glucosamine, chondroitin, this and that, that's fine. As long as it has omega-3 fatty acids, I'm happy, you know? I think there's a question though.
Yes, so we have two questions asking about exercise in dogs and if that will help arthritis.
Yeah, so you do want to, yes, exercise will absolutely help, but it's always like it's moderation, right? You don't want to say have your dog sprint downhill a trail, for five miles. That's going to be a lot of wear and tear on the elbows and shoulders. If you do that on a daily basis, it's eventually, just like us, there's going to eventually be a point where there's just too much wear and tear, and it sort of is what it is.
Yeah, and some dogs never stop.
And some dogs don't stop.
Can't self-regulate.
And what's interesting is, we can take X-rays and you'll see radiographic evidence of arthritis, but a lot of times it doesn't hurt. It doesn't hurt the dogs at all, and it's just it's not causing any pain. So that's great. And when there is a lot of pain, and then the arthritis, is pretty severe, and there's not a surgical correction for it, then that's when we start reaching for stronger pain medications such as non-steroidal anti-inflammatories, and those are very common to give. A lot of people have heard of Rimadyl or Carprofen or Vetprofen. They're all the same drug, and what it is, and a lot of people don't realize this, is you're literally giving the dog version of ibuprofen. Now, we can't give dogs ibuprofen because that'll make them sick, or cats, but the mechanism of action that we use for the dog pain medications is the same as ibuprofen. They can just metabolize it better. And so what I'll tell people is, if you just like you and I, if we need ibuprofen every day because our back hurts, well, it sort of is what it is, but if we only need it, when we play football or something, or soccer, and we have a really hard day, then that's when I use it. And that's usually my recommendation for owners that have dogs that have, a pretty bad arthritis where they do get sore.
Okay. Any other question?
We have one more question from McKenna, and she is asking if you recommend getting X-rays done every couple of years to keep an eye out for arthritis.
That's a great question. I think it all depends on, what are we going to do about it, right? Is, I guess, my answer is, I think more than anything, it's probably more important to bring in any limping, any lameness, any pain. I think that would be more beneficial. I'd say
also have those routine exams to really
exactly
see
to
if
look
the
at
vet
that.
knows
But
picks up on that.
But a lot of times, if you say, hey, I have some X-rays that I took, 6 months ago because I do this every 2 years, and now my dog's limping, I'm going to say, well, that's great, you have them, but I need to take new X-rays because something's changed. So I probably wouldn't spend the money on it unless there was a good reason, would be my recommendation, and save the money for a rainy day. Yeah.
Oh, that's fine. Sure.
And then we have one question from Georgina. Do probiotics help with dogs and arthritis?
Great question. I don't think there's any direct evidence that probiotics will help with arthritis. So I think that's kind of to be determined. Similarly, I get a lot of questions, about stem cells, for example. And I'll tell you that with stem cells, unfortunately, with the veterinary profession, you don't need to go through a lot of hoops to sort of provide a new therapy, which is good and bad.
Yeah.
The good news is that makes it very affordable because these companies don't have to do a tremendous amount of investing in research, so that's very nice. But the bad news is that the jury's still out for a lot of stuff, and I think, in my opinion, and there's 100 opinions out there for stem cells, is that, to me, I don't feel comfortable using them on a regular basis or recommending them on a regular basis because there's just not enough evidence out there for me to be convinced that it actually helps. That said, I do think it provides anti-inflammatory effect when used, but I haven't seen any evidence where it can reverse stuff per se. And it's really expensive. I mean, you're talking about treatments that typically cost about $2,500 to potentially have a transient anti-inflammatory effect. That's a lot of money. So for me, before I kind of offer that to everybody, I feel like there just needs to be more research. I think that there will be a place for it at some point in time, but I personally am not convinced that it's something that I can, confidently, say, hey, do this for your dog. You're going to be so happy.
Yeah.
Because it's just unfortunately unpredictable and not there's no I guess evidence-based science behind it yet. Not enough.
And where do you harvest the stem cells from?
So typically, there's a few different places you can get it. People will talk about the umbilical cord, right? I think in humans they'll, if you have a new kid nowadays, they'll offer you for I don't know how many dollars you can save your kid's umbilical cord for some treatment later on in life. But we don't do that in dogs, obviously. But what we can do is we can harvest stem cells from fat. And basically what we do, the process is usually we have a dog come in, they get anesthetized, we do surgery and make an incision over their shoulder or their abdomen, collect fat, send it to a lab where they isolate the cells, and then they send it back to us in a vial. Then we have to bring the dog back and sedate the dog and infuse them wherever it is whatever area that we're trying to treat. And so I think there are specific applications where you might say, hey, this is a very rare condition and we can try it for this. But for run-of-the-mill arthritis, I currently am not convinced that for the cost that you'll have a convincing benefit.
Yeah.
Yeah.
It's definitely an interesting field, and even stem cell therapy is used in the dermatology field right now, but there's just not enough evidence for our side either to recommend these types of therapies right now. And even probiotics is a little controversial in the dermatology world, just because of the fact that we don't even know if these probiotics actually make it through the gut, first of all, the gut enzymes, and even colonize the GI tract. So they may just be something that goes in and out and does nothing. So hopefully we'll get more information on these things in the future, and our field always grows and research always happens. So hopefully, in the next few years, more stuff will be coming out and we'll have more information for you guys on that. But I hope you guys liked this Facebook Live. If you did, please give it a big thumbs up. We will actually be here in 2 more weeks.
I think one thing I'll point out
Yeah.
is something I don't know about, and I think I get a lot of questions, is CBD, for example.
Yeah, that's a good one.
And that's a good one to mention because there's so much of that around, and it seems like you and actually, I was approached by a company asking if I would help them formulate a CBD concoction for dogs, and I guess I'll ask the public, like, is that something that you guys would be interested in seeing or doing?
Yeah, or are you using it right now?
And certainly I know there's people who use it who have had good experience with it. As veterinarians, we're technically not allowed to recommend it. Because there's really no proof for it at all, but I know a lot of people are using it. So it's just and there's more and more research coming out, and obviously, as we've seen on the human side, there's benefits to it. So I'm curious. I guess I'm curious to see what's going to happen with that, and I'm wondering also kind of what the public thinks of that too.
Yes. Yeah. Interesting to hear your thoughts.
You're getting a lot of hearts around this topic. A lot of people are responding with hearts and thumbs up, so it seems like a lot of people are interested.
Cool. Okay.
Awesome.
Awesome.
We will be back here in 2 weeks, and we're going to be talking about anesthesia and sedation. A lot of you have asked about older dogs and the risk going through anesthesia and sedation. So we'll be covering those topics and kind of what to ask your vet before undergoing a procedure. But we'll be here at the same time at 4 o'clock in 2 weeks. Thanks.